And I ended up having an MRT meeting that night before at 3 a.m. because I passed a blood clot the size of a fried egg, and I am the talk of the floor. We are on our way to Cincinnati again. So that was our stop 1 for the day. No, dose, because we stopped and got gas. We haven't even left our town. I just realized.
Yeah.
And what time do we leave the house?
7:04.
Yeah, so we left the house at 7. It's past 8 now, and we've already stopped twice in our town. That takes like 10 minutes to get through normally. And this time we didn't go through the mountains instead of on the interstate. What should I say?
I don't even know.
Yeah, I didn't vlog in like 2 weeks since the last trip. In the interim, they did change my steroid. I'm normally on Cortef, but they put me on Medrol, and they were trying to judge the response of my liver after they put me on the Medrol on a higher dose for 2 weeks, and my liver's not responded well to that. I'm not even certain it's from the steroid itself, honestly. I think it's just whatever it's been doing, it just hasn't helped, period. And I don't like Medrol at all in comparison to Cortef. I think from a mast cell standpoint, although mast cell is not the reason they originally changed me to Medrol, but I think that from a mast cell standpoint that the Cortef is much more effective. And I know it's not necessarily supposed to be that way, but that is how I experience it. I've been tons more reactive, in my opinion, on the Medrol. The Medrol has helped my joints a lot, though, if I had to say a positive. And now I'm on the wean down, and they're kind of weaning me down pretty quickly. So we arrived at the hotel, kind of reactive and pretty miserable. We're in the same room in the same hotel that we stayed at last time. I'm having to do a 24-hour urine for my methylhistamine levels, my prostaglandin levels. Last time I was supposed to do it, but we didn't have any way to keep it on ice. We weren't prepared for that because I wasn't aware they wanted me to see the allergist while I was here in Cincinnati. I thought it was a waste of time because I've already been diagnosed with mast cell, and retesting everything isn't going to change my treatment. But I promised that I would just do it next time and when we could come prepared, and so we did. We brought our cooler. If we did it last time, we would have to carry it around the hospital all day, and that's not realistic to have a thing of pee and in a bucket of ice sitting on my lap while I'm wheeling around the hospital to appointments. So we did it. Started it last night at 2 a.m. while I was still at home, and even while we were traveling, we've kept it in the cooler on ice. We had to stop and get 2 containers because last time they only gave us 1, and I filled that up in less than 12 hours. But I'm supposed to see the allergist on Friday, but tomorrow I go see the bone marrow transplant team, and then the hepatologist who specializes in immune problems that cause liver disease, and then the director of small bowel transplant who has special interest in liver disease as a result of major bowel problems and bowel resections. So it kind of fits me to a T between all the specialists they have me seeing. Teddy and I are in the car waiting on my parents to drop my 24-hour urine off, and on our way here I have this terrible cough, and I've had it for weeks, and I don't know what it is. Like, I'm not sick. I don't have any other viral symptoms. I've had it for 3 weeks now. It was lasting all day long, and then I was on steroids, and then that made it decrease, and I would only get it a little bit at night sometimes. And now that I'm leaning back down on the steroids, it's come back. So I can't talk very much. But, because every time I try to talk, I just have that cough sensation and feel short of breath, and my back really hurts on one side. So I don't know if I've irritated an organ that's inflamed in there, or if it's my lung, or what the heck is going on. But anyways, while we were driving here, our car was giving us the warning of low tire pressure, and our tire pressure was at 14%. So we assume we have some kind of nail in the tire. My mom and I are going to do the hospital appointments while my dad takes Teddy with him. Because I don't want to bring Teddy with me, even though he's got his service dog vest and information. He's just not there yet to do an all-day 3-appointment trip. In my opinion, he's wonderful and he behaves, but I just don't think he's there yet, and having to take him out to potty and that sort of thing, we just don't, my mom doesn't need that extra responsibility right now, because I don't know if they're going to tote me around for tests today or not.
No, that makes it worse. Aw, can I have it? Can I have it? Please. I got a soggy woggy.
He loves playing on the bed. He loves catching them too.
Hey, I want to order 2 guest trays, please. Okay, that one, he wants the steak hoagie with mozzarella cheese and marinara sauce. And then the 2 sides is going to be a baked potato and celery sticks. And then, what else did you want, Sean? I forgot. What'd you want to drink?
Orange juice.
Orange juice to drink, that's weird. And his dessert is a cupcake. That's kind of weird, babe.
Well, I did not vlog much during this hospital admission due to hospital politic reasons. I'm going to try to explain this in short little intervals. About 2 weeks ago, I was originally in Cincinnati for clinic appointments. I saw a bone marrow transplant, small bowel transplant, GI, and hepatology. When I got to hepatology, I was told that I had about 3 months to get my liver in check before I had to be listed for a multivisceral transplant, where they would transplant the liver and bowel. And the hepatologist, although I'm 23 and this is a pediatric facility, said that he was willing to admit me under his service in attempts to make some TPN changes. What we were going to do is to change my lipids from intralipid to omegaven, since I didn't do well with SMOF, and drop in J-tube to try trickle feeds, which I know, as everyone knows, does not work and sends me into these episodes, but I was going to cross that bridge when we got there, and hopefully they could see those episodes happen and do something. The hepatologist said that he would not give up, and that he would just he was willing to try and see what he could make any promises, but he could see me outpatient and clinic and then do this one admission and see what happened. As soon as I got back to the hotel, I went to the restroom and noticed it was pure syrupy red blood. I was a bit alarmed, but I wasn't feeling dizzy or anything, and I knew that I had an admission planned the next day. We were not prepared for an admission, so my mom and dad went to Walmart to pick up some things. And while they were in Walmart, my mom received a phone call saying that there were some holdups with me being admitted, that they were concerned about IV tubing. Although I require brand-specific supplies due to mast cell activation syndrome, I can't have certain IV bags that have different plasticizers, because the plasticizers like DEHP and PVC, they leach into the fluids, and hence then they get into the bloodstream when they're infusing. But tubing has never been a problem. They are free from those things. And any other tubing really isn't compatible with a hospital pump anyways, so there's not much of a choice but to use tubing.
The pharmacist has sent a list of supplies that he provides for you, and on that list he sent what he provides you, which is home tubing, which doesn't even go with hospital.
We're trying to explain to them, like, no, tubing is not an issue. I think that they thought I was too much of a liability because of the mast cell disease. We're all upset because I'm bleeding out my bum, and it was getting bad. The hepatologist called the higher ups or whomever, and a way to get me in the door was to go see their allergist. The allergist had ran some mast cell mediator tests and evaluated me based on my previous mediator test and the combination. He confirmed that I do in fact have mast cell activation, but that my current treatment plan is sufficient and it shouldn't be an issue for me to be admitted to the hospital. He conveyed that to the hepatologist, who then conveyed that to whomever he was supposed to be informing. But in the interim, as soon as I met that doctor, the moment he walks through the door, I decide I'm going to have a nosebleed. So now I'm bleeding out my rear and my nose. The allergist was freaking out about my nosebleed because he also knew I was bleeding from my rear. We thought the admission was all set and ready to go, and we get back in the car, and then the hepatologist nurse calls and saying to show up at the hospital. We got like 5 minutes down the road, and then the nurse calls back again saying that I cannot be direct admitted because now I'm considered unstable because of my bleeding. So I would have to go through the ER first prior to going up to the floor. I'm on like the liver and GI floor. They run an abdominal x-ray which shows obstruction, like always. And did some labs. My hemoglobin was stable at that time. All was well in the world, and they cleared me to go up to the floor. I got up to the floor, and I was there for a few hours, and then I feel my fever coming on. I've got the chills and rigors, and my pulse is up, and blood pressure lower, and of course, like, leave it to me to spike 103 fever. So then they want to start sepsis protocol, although we all know it's not sepsis because I'm the girl who cried fever from the macrophage activation syndrome. And all of my inflammatory markers, like, that were normal before leaving, just kept climbing. Then I get moved to the PICU. There's 10. And it's snowing.
And there's Sean, and in the window it's snowing outside. You tell her where
They
you
didn't
are.
think it was
She doesn't know where you are.
In the PICU.
They didn't say it was going to snow this much. They said it was just going to be little spits.
And that seemed to be where the problems just started happening. We were told by the admitting doctor and the nurses to bring my safe supplies until the hospital was able to obtain them, which only took them 24 hours. But I guess when I was transferred to the ICU with the stricter regulations, they were not informed of that. So although I was only connected to my home infusion supplies for a matter of hours before everything was able to be switched over, they didn't like that and they didn't want me there. They came up with a lot of different excuses, but one was my age because I'm 23 and this is a pediatric institution. Another one was my mast cell, which, you know, if I hear the word mast cell one more time, I was going to scream. So here I am, bleeding out my rump, and it just keeps getting worse and worse, and I'm passing all of these clots. And then a whole team of doctors come into the PICU. They're trying to transfer me to Cleveland Clinic. And by that time, my H&H is starting to drop and all my counts are low. And I ended up needing 6 transfusions. I couldn't sit up in bed without blacking out. When I stand, I was just fainting. And they wanted to transfer me hours away. We got past that hurdle. Then they decided they were going to place PCAs and sitters in my room the entire time.
Because they're afraid of anaphylactic.
But yet they wouldn't reveal to us the reasoning for that, because where we're from, when you have a sitter, it's because they don't trust you, or you have dementia, or you're a flight risk. And I don't think they were much concerned about me being a flight risk, because I could barely sit up in bed. Later we found out it was because they were afraid of anaphylaxis. But, I mean, mast cell, right, that is the least of my issues. After they realized that I tolerated my blood transfusions, because that was kind of a newer thing and no one's ever wanted to give me blood before, but this time it was 100% necessary. There was no way around it. They managed to get me back on the regular floor through implementing this plan called an MRT. The MRT stands for Medical Response Team, and basically what that is, it's a group of doctors that are on your case, and when a situation arises that could potentially be ICU worthy, they convene. They have 15 minutes to discuss, and then they will make an executive decision on whether to transfer to the ICU or not.
They set very stringent parameters.
Yeah, and each parameter, it's like catered to the patient, so it's not all like one set of diagnostic criteria. To find the source of the bleed, they had to put me under for a scope. They followed my regular anesthesia protocol that I normally do at home, although it was kind of scary being put under in a new place, because I just don't like being put under anesthesia in general, and I usually have an emotional breakdown every single time. During the scope, I guess I don't know this because I was asleep, but the doctor said that he found blood around the ulcerated area of where my resection was, and then I had all of these strange looking rashes that would ooze blood when they were touched with the water. They said they'd never seen anything like it, so the GI doctor called in all the other GI doctors on that floor to see their opinion of it, because no one had ever seen it before. With so much blood found during the first scope, it seemed to be, like most of it was at the area of the resection, but a lot of it was going higher up as well. He couldn't like confirm if there were tons of sources of the bleed or if it was mainly from that one area, because although the patches were bleeding, it wasn't like enough blood to cause what they saw. Yeah, I can add pictures and it's kind of gross, so you can skip it if you want. So then the next day, they wanted to put me under again to do a repeat scope, because I was still bleeding and still requiring more transfusions.
You scared everybody with it.
And I ended up having an MRT meeting that night before at 3 a.m. because I passed a blood clot the size of a fried egg, and I am the talk of the floor. I hadn't been able to really get up, so I was on the bedside commode, and I went to the bathroom. I didn't really pay much attention, I'm just too sick to even care. And the PCA that was helping me in the room, she looked down into that little pan, and her eyes got like, she went and got my nurse. So then my nurse is coming up in here, and they're trying to turn on a light to see, and then when she does that, then the nurse is like, the nurse went to go call the doctor. I just fell back asleep because I didn't feel good. Apparently, my mom woke up at 3 a.m. like saying, Lori, do you want to join the meeting? And she's like, what meeting? And she's throwing on her slippers and she's in her pajamas. And she didn't even know any of that went down because she was out, I guess. Yeah, I had my MRT meeting, and they just really were trying not to move me back to the PICU because that's where they don't want me. Second scope wasn't as bad as first scope. He found that the majority of the blood is around the resection site, and it was just backing up further in my intestines because of my motility. They took biopsies, and those biopsies came back showing features of vasculitis. Later, it was showing something called TMA. Normally, it would affect all the organs and the kidneys and your blood counts, whereas mine is just localized to the GI tract, and it causes gastrointestinal bleeding, pain, etc. Many things can cause TMA. It could be caused by a problem with the complement system, which every single one almost of my complements are off. It can be caused by autoimmune diseases, metabolic syndromes, infections. Since I was in the ER, I'm going to backtrack a little bit now that I'm over with the GI update. I kept complaining about my lungs. I had this strange cough, and I just felt weird in my chest, and I was having difficulty breathing. One of the doctors noticed that my sats were dropping to the 90s, and I couldn't sit up without hacking or these like terrible like coughing fits. So to make a long story short, they assumed I was bleeding into my lungs because they did a CT scan that showed, what was the term? Glass opacities. That could be indicative of blood. They did an emergency scope over the weekend, and the scope came back showing that I have a type of pneumonia called PJP. Everyone naturally has that bacteria growing in their lungs, but when your immune system is on the fritz, like mine is, sometimes the body cannot keep it in check. I am on IV Bactrim 3 times a day for 21 days, and after that I have to continue prophylactic treatment with pentamidine. If I do the inhaled pentamidine, it would be every 28 days. Prior to my scope, they tried to kick me out again, even on the regular floor. After the last doctor who was on had promised that they would not give up or push me out. Then the new doctor comes on, and they don't feel comfortable because I am an adult patient in a pediatric setting. Even though I look like I'm 12 years old and I'm 80 pounds. They didn't feel comfortable doing a third procedure at this hospital because I'm an adult. And I think that is a bunch of hooey, because Cincinnati Children's does have quite a few adult patients. They even have an adult patient care team that kind of works with the other specialists who I did have on my case. So they tried to send me to the hospital across the street. Then he was saying that he called Boston, he called a couple of other institutions, and he said this is a problem. And he's talking about my infusion supplies, which the only infusion supplies I require is Bebron saline that you mix my meds with. And I do best with APP Benadryl and Westward famotidine. That is it. Those companies can drop ship those products in 24 hours or less. So they're giving me this bull crap, pardon my French, that it's all my age, but really it's the mast cell disease that's freaking the higher ups out, I believe. All these other institutions are denying me, but I know it's only because this doctor is not conveying the situation correctly to them.
He's in tunnel vision. He won't even listen.
And he won't even listen to change his mind. You tell him something and he has his opinion, and that is it. There's nothing anybody can say to him. No other doctor, no patient, no nurse that will change his mind. So I'm technically discharged as a patient, even for outpatient clinic appointments, which prior to this admission, I was still going to be allowed to continue care outpatient. I just wouldn't be able to come inpatient again, but now I can't even come back at all. And it's very disappointing because I was promised that these people would not give up and that they would find out what was going on, because some people just can't get over a mast cell problem. And I've had one reaction since I've been here, and it wasn't even a bad one. My vitals weren't affected at all. So I have to finish my 3 weeks of treatment for the PJP, and after that I have to try to find a whole team to have these different complements retested and different markers retested in order to locate the underlying cause of the macrophage activation, and the if my TMA is caused from an autoimmune disease or like a problem with the complement system, then those labs after the infection should show it. Now I am on too many steroids and with an infection present too. It is muddying the waters, so to speak. So they aren't certain what values are skewed or if they're even skewed at all. And where I'm going to go to do all this, that is what we do not know, because I apparently need to find, because I need to find an adult hospital that is a little bit more competent than my local hospital. I mean, they're great for admissions close to home, but as far as diagnostics, they are not ideal. Good morning and welcome home to us.
Somebody needs some loving this morning.
You can hear him purring.
Look at him.